Welcome to Season 2, Episode 6 of the Home Healthcare Today show. I'm your host, Dr. Cleamon. It's March, and March is National Kidney Month. March is also Women's History Month. We have the honor for this episode to be guests in the office of Kidney Michigan. Kidney Michigan's lead doctor, internal medicine doctor, and nephrologist is Dr. Claudia Saharak. Dr. Claudia Saharak has been a nephrologist and internal medicine doctor for several years. She came to the United States from El Salvador at the age of 18 to pursue undergraduate studies in Texas as well as to attend medical school. Dr. Saharak has been practicing in the Saginaw, Mid-Michigan area since 2008 and has seen thousands of patients in this area. Dr. Saharak, welcome to our show.
Thank you so much for having me here, and I'm really glad to meet you and be here. This is quite an honor.
My pleasure, Dr. Saharak. So, Doc, could we go back a little bit over your background? Tell us a little bit about, undergrad and grad school in Texas, your teaching background, and more about your passion for taking care of patients as well as kidney health.
Yeah, my passion has always been practicing medicine, and I developed that very early in my life, growing up in El Salvador, like you mentioned that.
Yes.
There was a need for a lot of doctors, especially growing up during the war.
Yes.
I moved to San Francisco with my family when I was 18, and I started in a community college doing English as a second language.
Hey,
And then we transferred to University of St. Thomas in Houston
Yes.
to do college education. From there, I went to medical school at University of Texas in Houston.
Okay.
And then I worked as faculty. I did my residency and internal medicine residency and fellowship in nephrology at University of Texas in Galveston, where I stayed to work as faculty for 3 years.
Okay, so this is a very, very interesting as well as inspiring story and background. Oftentimes, Dr. Claudia, we want to inspire and encourage students, that are pursuing careers in health science, as well as we're commemorating Women's History Month, right? So when you think about some of the mentors that you may have had along the way that were either faculty members who were women or practicing physicians, are there any good stories that come to mind about some of those mentors?
Absolutely, and during history too. I mean, there's a lot of really smart women that have inspired me.
Yes.
There's two particular women that came from El Salvador. One of them is the one married to the Little Prince author,
Yes.
Antoine de Saint-Exupéry.
Mm-hmm.
Also Joan Nash's wife, she's from El Salvador. So both women come from El Salvador, very accomplished women.
Yes.
Madame Marie Curie is also another inspiration. And then personally, I would mention Dr. Bella Royce.
Yes.
She is at the University of Texas in Galveston. She definitely was an inspiration for me.
Wonderful, wonderful. Great examples. And I'm sure not only were they examples of you, you are a wonderful example, to your students as well as your staff and patients. So thank you for sharing those examples, Dr. Claudia. We would be remiss if we did not discuss, obviously, COVID. We're not going to spend a lot of time discussing COVID. Hopefully we're on the downturn of the virus 2 years later. What did you see, Doctor, over the last couple of years in view of COVID and its impact on patients and kidney health?
Well, I think when all this started, it was a scary situation for everybody.
Yes.
For everybody in the office, for everybody that works in the hospital, for patients. They were very, very scared. My main goal at that time was to remain open.
Yes.
Patients still needed care. So we took the precautions. You see, we have shields. We protected ourselves. It was even though it was a very difficult time, I do remember with a lot of fond memories what patients would bring me when it was really hard to find hand sanitizer. I had
Yes.
patients bringing me bags of hand sanitizer to protect me.
Yes.
I had patients bringing me handmade masks.
Yes.
It was really touching.
Definitely.
A lot of patients, we have very close communication with my patients. So basically, they have access to me, I would say almost 24/7.
Sure.
And several times I get through the night or during the weekends calls saying they can't get a hold of their doctor, they need insulin, they are running out of medicines, and they have nowhere to go.
Yes.
And so my goal was to remain open, be available to them. We never really closed.
Yes.
And I'll continue seeing my patients in the hospital. The greatest impact that I saw during COVID for the majority of patients in the hospital is the isolation. I think that was extremely detrimental for the mental health.
Yes.
And so we made, you met my nurse practitioners.
I did. Yes, indeed.
And
Yes.
we made a point of always going to visit our patients in the hospital. We never stopped.
Definitely, definitely. And I'm sure that they and their families were thankful, that your office did not close, and with the space in your lobby and facility, you were able to have some social distancing and then carry out the various protocols, to reassure patients that they were in a safe environment, but to not neglect their kidney health and not to neglect the importance of their appointments.
Absolutely.
Yes, Dr. Claudia. So this area, Saginaw, right? Saginaw and the hospital corridor with Covenant and the like and some of the other players. Tell us a little bit more about this location and then more about your team members. I met some of the nurse practitioners and some of your other staff, the nurse and intake and researchers. So tell me a little bit about the team.
Oh, the team is wonderful.
Yes.
I mean, one thing, everybody that comes on board,
Yes.
I emphasize to them, we are here for patient care.
Yes.
Period. Patient care. So we are available to them no matter how hard it is. We don't like to pass the ball. It's
No.
not our job. It's not no. If they call here, they're gonna find help.
Yes.
We try to help the primary care doctors too, because they're sometimes overwhelmed with prior auths, and sometimes
True.
medications are really hard to get by. So I always say I have a small office, but overstaffed. And we do work nonstop until we get all the prior auths. We do peer-to-peer with insurance companies.
Yes.
We make the time to get the medications the patients need.
Yes.
So we do have a fantastic team, and they're all committed. But it starts from the beginning, establishing, knowing that our priority, we're here for patient care.
Yes. And that is so good to hear, Dr. Saharak, because the triangulation of being a specialist, but working with so many primary care physicians and being an internal medicine doctor, being an internist, you understand the primary care side of overall health and wellness, the insurance nightmare for a lot of patients, and then the delivery of their medications and coordinating not only care, medication, and then of course billing and remittances in view of that. Yes, having the right team or having individuals that don't pass it off and say, well, that's not my part, I'm not answering that call, but having folks that dive in to see where they can help and how they could work collaboratively to meet various needs of patients is really good, right?
Absolutely.
So, and I think that helps your primary care physician network to refer more patients to Kidney Michigan because they understand that the patient won't get dropped in between the cracks. So this is really good stuff. Doctor, as we go back to kidney disease, for patients, what are some of the warning signs that they should be cognizant of? And then in layman's terms, what are some of the stages of kidney disease?
So, unfortunately for kidney disease, I would call it the silent killer, basically, because you don't have any warning signs until it's too late.
Yes.
So that's why it's so important to have regular checkups. Perhaps if you're healthy, maybe once a year at
Once a year.
least.
Yes.
get some labs and some urine testing
Yes.
to know if there is any problem or not. Because initially during kidney disease, you are not going to experience any symptoms. You may have high blood pressure, a little bit of fluid in the legs, but that doesn't necessarily mean kidney disease.
Right.
And a lot of us don't make the connection between that until it's too late.
True.
So the way I usually explain it to my patients is, we're born with two kidneys,
Yes.
100% of kidney function. You have so much kidney function that you can actually spare one kidney,
Yes.
right? And have a perfect life. So even though there is a great incidence of kidney disease,
Yes.
it's not too late to make changes in lifestyle
Absolutely.
to be able to prolong that life of the kidney.
Yes.
So even if there isn't any diagnosis of kidney disease, having a good lifestyle really prevents you from having kidney disease later on.
Yes.
And even if you have kidney disease now, it would prevent you from progressing
Yes.
to the point of needing dialysis. So that is the focus of my practice here. We do spend a lot of time with each patient to educate them, to make sure they understand, and they understand why we're recommending what we
Yes.
recommend.
Definitely, yes. So, Dr. Saharak, that makes me think, as you talked about, healthier choices with diet, with exercise, and with, staying away from excessive drinking or excessive alcohol use, right? Those are some good tips. Are there any other tips or advice that patients should consider whenever they think about their kidneys and kidney health?
Sure. I mean, usually what I recommend my patients is eat as natural as you can.
Okay.
So nothing that comes in a can, nothing that comes in a box
Yes.
or frozen or pre-packaged.
Yes.
Those usually are not the healthiest choices. So
Yes.
actually, healthy eating is relatively inexpensive.
Yes.
And I tell my patients, when you go to the supermarket, just pretend that you're actually hunting or you
Yes.
are harvesting yourself.
Yes.
The fresh meats, fresh vegetables, fresh fruits.
Yes.
Flavor the food with herbs, but don't go to the middle aisles where everything is boxed and canned and
Absolutely.
frozen.
Yes, yes, and that's it's a quicker and perhaps more convenient dietary regimen, but more costly in the long run as we think about our health and we think about our kidneys. Dr. Saharak, talked about interventions and treatments, and that's our last question prior to our commercial. Over the last several years, what have you seen in the world of kidney science?
So for intervention,
Yes.
there is a lot of new drugs coming up. Some of them are already in the market. Some others are in research, in the research area.
Yes.
We are actually, in fact, doing a clinical trial on
Wonderful.
probiotics to prevent progression of kidney disease and hopefully delay that onset of needing dialysis and possibly completely
Yes.
fix it. So we are in the process of doing, and we're actually in the process of recruiting patients
Wonderful.
for that.
Yes.
Then that is the medicine aspect. Then there is the technology aspect.
Yes.
I've been following this new development of an artificial kidney. They're using nanotechnology, and they're
Yeah.
infusing it with cells that actually not any bigger than a dialyzer. And it's an implantable device. And
Yes.
basically, your own blood flow would be triggering the flow. This is right now under evaluation
Sure.
at the
Sure.
FDA.
Yes.
And it's very exciting. It's been several years, but it takes several
Yeah,
years to
it
get
does.
things in the market.
To move it forward.
We wanna make sure everything is safe
Indeed.
and effective.
Yes.
But this is very promising. It's like getting a kidney transplant for everybody, not just the ones that can get a kidney transplant.
Yes, and that will be a tremendous game changer, right?
Yeah.
For sure. Dr. Saharak, we're going to go to a commercial. We'll come back and we'll talk more about prevention and, of course, home care a little bit and even dialysis in the home for patients. So
Sounds great.
we'll be
Thank
right
you.
back. Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot. Welcome back to Season 2, Episode 6 of the Home Health Care Today show. It is National Kidney Month. March is also Women's History Month, and it's National Nutrition Month. So we have a lot to celebrate as well as to bring attention to in the month of March. We are in the office of Kidney Michigan with Dr. Claudia Saharak. And prior to our commercial, we were having an interactive dialogue, right, about kidney health, the impact of COVID, recent developments, innovation, as well as technology and medication to help patients with kidney disease. Dr. Saharak has also worked with the Food and Drug Administration, which is a timely mini dialogue for us to have as related to National Nutrition Month. And then the fact that diabetes type 2 is the leading cause of kidney disease. Dr. Saharak, do you mind shedding a little bit more light on your time and work at the FDA and then some of the insights that you gleaned from that experience?
Okay, sure. Thank you.
Thank you. Yes.
So I worked there for about 7 years.
Yes.
It was a remote work because I also kept my practice. I also kept the hands-on experience.
Yes.
I mainly work with devices, so anything that was any devices for kidney health or kidney disease, dialysis machines. We had to make sure that they were safe and effective before they go in the market.
Yes.
And then there was also post-market surveillance to make sure that what we thought is actually applicable once it goes to the general population.
Yes.
It was a fantastic time. I mean, the people I worked with were wonderful, very conscientious,
Yes.
very, very good experience in general.
Very good, very good. And Doc, in view of kidney disease and post-diagnosis for patients, of course, there's dialysis, and then there are transplants that some patients have for their kidneys, kidney transplants. It is wonderful to know that dialysis and kidney transplants aren't the end of the road for patients. So could you talk a little bit about some of those, I want to say, success stories of patients who have gone through dialysis and come off of dialysis?
Oh, yeah.
And or patients who have successfully recovered after a kidney transplant?
I have several of those, both of them.
Yes.
So the most common one is you get a kidney transplant and you go basically back to almost normal life.
Wow.
There is the anti-rejection medications you have to take, so you
Sure.
probably never have to be able to get off that.
Yes.
But it gives the opportunity to patients to go back to a relatively normal life. So
Yes.
kidney transplant is, by all means, the best outcome after reaching CKD stage 5. And I guess we're going to talk about the stages of kidney disease too.
Yes.
So regarding kidney transplant, unfortunately, this surgery is a major surgery. So the patients are highly selected. Healthy heart, healthy lungs, healthy ability to recuperate from these major surgeries. So as you can see, it's not for everybody.
Right.
But the ones that go through it, most of them are pretty successful.
Wonderful.
In terms of dialysis, yes, there are events, and I have several patients of them that go into an event of acute renal failure or kidney disease that just happened in the moment from COVID. COVID
Yes.
caused a lot of kidney disease.
Yes.
And then the kidneys have a way of healing themselves. It depends on where they started, but say they started with CKD stage 2 or mild kidney disease, and then they went into a fulminant kidney failure, go on dialysis, and then they start
Yes.
making urine. We have to always be watching for their ability to make urine. The moment the patients tell me after dialysis they feel super tired,
Yes.
they're making a lot of urine, we stop dialysis. We monitor them very closely here in the office
Okay.
and check labs, twice a week, three
Yes.
times a week. And I have several patients that we have been able to get off dialysis.
Okay.
Again, not for everybody.
Sure.
Then the most common one is the ones that start with kidney disease and they go through the stages that we're going to cover in a minute. They get to
Yes.
CKD stage 5. By that time, the kidneys are kind of scarred,
Yes.
and it's hard to reverse that scar.
Okay.
So do you want me to go over
Please,
the
let's go through those
CKD
stages. Yes,
stage?
indeed. Yes.
So those are
Please.
divided in numbers. So remember at the beginning I said we're born with 100%. So
Yes.
anybody who has a little bit of kidney changes that are not normal, say for example they're born with one kidney,
Yes.
or they have a structural abnormality, that's already CKD stage 1,
Uh-huh.
but fantastic kidney function, 90% to 100%.
Yes.
Then we go into 60% to 90%, that's CKD stage 2. CKD stage 3, which is the vast majority of people, is between 30 and 60.
30 and 60. Okay.
CKD stage 4 is between 15 and 30.
Yes.
And less than 15% is CKD stage 5, and that's when they need some kind of renal replacement therapy, either either kidney transplant
Yes.
or dialysis.
Okay.
So when I said that my vast majority of patients are in CKD stage 3, sometimes they don't even know it.
Wow.
The good news is that you don't have to ever go on CKD stage 4 or 5 if you
Yes.
start acting now.
Acting now. Yes, definitely. And then for the patients, to your point, that don't know that they're in 1, 2, or 3, the annual and regular checkups are vitally important.
And lifestyle changes.
And lifestyle changes, absolutely. Knowing what those risk factors are in view of heredity and genetics. But more important to heredity and genetics, I think we discussed it, Dr. Saharak, that we could modify. And we could modify our diet. We could modify our level of rest as well as exercise. And we could definitely limit our alcohol consumption. All right, so this is very, very helpful information, Dr. Saharak. As we think about homebound patients, recovery and homebound patients, and to your point about the impact that COVID had on patients and kidneys and kidney disease, what do you think, Dr. Claudia Saharak, about home health care? Could it be of great assistance to patients who are recovering or have later stage kidney disease?
It's a wonderful option. And when we say home care,
Yes.
I see it as a little different as homebound.
Yes.
So homebound are patients that cannot get out of their house.
Yes.
And we have also helped patients in those situations.
Yes.
Patients that are, for example, paraplegic.
Yes.
Or patients that have a lot of difficulty moving in and out of their house.
Yes.
We have brought in home dialysis to them, and we bring
Yes.
the entire team to their house to do dialysis there. We do rounds bedside
Yes.
with their families. We bring a laptop and
Uh-huh.
all the equipment that we need,
Yes.
the dialysis equipment.
Okay.
We have had several patients like that, but that's not the majority. I do also have, and I'm a strong supporter of home hemodialysis or home dialysis, or is
That's
dialysis
my
done
question.
at home?
Yes.
But they're not homebound. They can still move around, and I think the major benefit I see on home dialysis
Yes.
is that patients are able, right next to transplant, be able to assume a normal life.
That's
and they're
what we
able
want.
to hold a job, because with in-center dialysis, it's difficult,
Sure.
right? It takes the majority of your day. Home dialysis allows you to work during the day, travel,
Yes.
visit family members,
Definitely.
do whatever you want,
Yes.
and then do dialysis at home at your convenience without a strict, it's Wednesday at 8 in the morning and I have to do this.
Yes.
So it gives you the flexibility.
Very
In
important.
fact, I've had home dialysis patients that they get up at 6, they do their dialysis from 6 to 8. At 8:30, they go to work 8 hours a day,
Wow.
and then they come back, and then they take the weekend off.
See, there you go. Wonderful. Dr. Saharak, for those patients and families out there that are new to the concept of in-home dialysis, is there any special preparation that a patient or family would need to take in order to ensure that their home environment is suitable for in-home dialysis?
Sure. The team actually visits the home to make
Yes.
sure that There is a space.
Yes.
You don't need a whole lot of space. And
Okay.
it depends on the type of dialysis you choose. You may or may not need a
Wow.
large room for storage.
Yes.
But for the most part, we want to make sure there's no pets running around,
Sure.
tripping on lines,
Uh-huh.
or that there is enough ability to cover the vents so that the vents don't throw bacteria and
Yeah.
dust into, say, for example, peritoneal dialysis catheter.
Right.
So it doesn't have to be a room where nobody else goes, but it has to be a room where when you're connecting to start dialysis, it has to be in the most hygienic conditions.
Definitely, definitely. Thank you, Dr. Saharak. Okay, I know this is a busy day, and you've been so generous with your time. A couple of more questions, and we'll be able to wrap up our interview. It's so insightful. Is there anything else going on at the clinic with your practice this month as related to, I guess, National Kidney Month, Women's Health Month, National Nutrition Month? What's happening in March here at Kidney, Michigan?
We are conducting a research study,
Yes.
as I mentioned before,
Yes.
and we are actually recruiting patients. The whole purpose of this study is to see if the probiotics could actually provide what we call it bowel dialysis.
Yes.
And this is to remove the toxins that the kidneys cannot remove anymore,
Yes.
and perhaps help the kidney health
Yes.
and prevent that onset of needing dialysis.
Okay.
But otherwise, every month is a kidney month for us.
Indeed, yes, indeed. Thank you, Dr. Claudia Saharak. Last question for you, question 10, as we wrap up here. Any other resources, clinics, or specialists would you recommend to listeners and viewers of the Home Healthcare Today show?
Sure. The NKF, for National Kidney Foundation, I
Yes.
think it's a great source of information.
Yes.
Also, something that it's a paid subscription, but I think is the best if you want to get to the science of things, is Up to Date.
Up to date.
Up to Date also has a section that is for patients, so it doesn't go into the technical chemical structures,
Right.
but it gives you a general idea. Otherwise, a lot of my patients like to do Google.
Yes.
And what I would caution about it
Uh-huh.
is that kidney disease is so vast.
Yes.
A lot of it is concentrated on CKD stage 5.
Yes.
So I have patients that come in with CKD stage 1, alarmed. I'm
Yeah.
going to start dialysis next month. And I
No.
said, no, you're probably never
Wow.
going to reach that point.
Yes.
Probably never. So, but all they read is one section of what's out there. You know, the sensationalism,
And
right?
it's,
The-
yep,
you
and
just-
it's a little misinformation on the web,
Yeah.
right? So we want to direct folks. We want to definitely direct them to kidneymichigan.com, which is an authority in mid-Michigan and the state of Michigan as related to quality kidney health information. And then, of course, the National Kidney Foundation. And then there is a National Kidney Foundation of Michigan, which is also a very valid resource for listeners and viewers. Well, this has been a pleasure, Dr. Claudia Saharak. We thank you for all of your invaluable insights as related to kidney health, nutrition to an extent, and thanks for being such a outstanding role model, right? Not only to women, but to patients and other, constituents. Great leader here in the community. And congratulations on from 2008 to 2022, 14 years of practice here in Michigan. Yes, taking care of thousands of patients and having such a wonderful and supportive staff. So best of luck to you and congratulations
Thank
again.
you. It's been a pleasure. Very
Pleasure
nice
is
to meet
mine.
you.
Thank you, Dr. Saharak.